Have you ever wondered how how long you would be able to survive with lung cancer, or have you even thought of what it'd be like living with lung cancer? You yourself, with your symptoms, your treatments, your surgeries that you've been through, your weaknesses, your strengths, your overall health, your age, everything. Or maybe even when and how you have been diagnosed. Did you know that around 100,000 people die each year due to lung cancer? But not all of these deaths are caused by smoking. About 87% of lung cancer deaths are due to smoking, but the other 13% are due to secondhand smoking, otherwise known as exposure to smoke. Roughly 1 in 300 boys and 1 in 333 girls will be diagnosed with lung cancer before they hit the age of 20. Lung cancer is more common in males, morally an older aged man who has been a smoker for quite a few ages, since childhood to old age, or teenage years to old age, childhood to middle age. Any of those ratios would work. 9 out of 10 chances that you get lung cancer or have been diagnosed with lung cancer is because of smoking. The other reason would be exposure to smoke, or known as secondhand smoking. The more you do smoke, the more likely it is for you to be diagnosed with lung cancer. More importantly, it is the amount of time you have been a smoker that really matters. So starting to smoke at a young age does increase the risk of being diagnosed with lung cancer. No scientist nor doctor knows on average how long a person can live with lung cancer, because there is no average amount of time that a person can live with lung cancer, because every person is different that has been a diagnosis of lung cancer. Every person has different treatments, different symptoms, different surgeries that they've been through. They have different weaknesses, different strengths. Their health, their overall health is different. Their age is different. Everything makes the answer differ. So that being, there is no real answer. There is no average answer. But saying that at the same time, some lung cancer patients only do live up to a year, but it's not because they all have the same symptoms, they're not the same age, they're not the same symptoms, they're not the same treatments they've been through, or surgeries, or strengths or weaknesses. They all have different ones. But it's the way that they carry themselves. It's the way that they portray and the way that they take care of themselves that makes this happen. But sadly, some people only live a few months because they can't handle everything. But luckily, some people live a few years. But 15 to 35% of people with stage 4 chemo only live 1 year if they are fit enough for chemotherapy. If not, the rate is about 10%, although most stage 4 lung cancer patients cannot be cured. There are no symptoms you should be worrying about in the beginning of being diagnosed with lung cancer, but as you carry on, you should severely start to worry. Because if you have been diagnosed with lung cancer and you know this, and you have not had any treatments done, have not had any surgeries done, you don't know your weaknesses and your strengths, you haven't gone into any medication, or you haven't seen as many doctors as you should, then you should start to worry. And if your symptoms that you don't really understand what they are, you haven't learned about them, you haven't learned what they can do to you, you should start to worry. Some symptoms of being diagnosed with lung cancer are coughs that get worse or don't go away, chest pain that is constant and made worse by deep breathing or coughing, shortness of breath, wheezing, blood-stained sputum, loss of appetite, weight loss, frequent chest infections, bronchitis, pneumonia, fatigue, severe shoulder pain. Severe shoulder pain tends to be a common symptom of Pancoast tumors, which Pancoast tumors you do tend to get. Some people tend to get with different stages of lung cancer. Some people get them because of their weaknesses or strengths. They might just have different sickness while they have their lung cancer. Other symptoms are collapsed lung and Horner syndrome. There are quite a few treatments, but different treatments work on different types of lung cancer patients. To decide on the right treatment, doctors will look at the type of cancer that the patient has, the patient's age and the patient's overall health and the stage that the patient's lung cancer is at, and their weaknesses and their strengths and the symptoms that they have been through. After the doctor has found out about those few things, the doctor then recommends certain types of treatments. He will recommend will then recommend one or more treatments if needed: surgery, chemotherapy, radiation, targeted therapies, and photodynamic therapy. Not all lung cancer patients are diagnosed because they smoke, but because of being exposed to smoke. Only 2 out of 633 people get diagnosed with lung cancer before they hit the age of 20, and it is not known if those 2 people out of 633 diagnoses will die from it. It's not known if they have been cured or if they will be cured. It's not known of their weaknesses, their sickness. It's just 2 people out of 633 people that will be diagnosed with lung cancer before they hit the age of 20. But that doesn't mean that they will not be diagnosed. That does not mean that they will not have different sicknesses. They could pass away from different sicknesses, as well as they may not. They may be cured. They may have gone through treatments and therapies and surgeries that will make the answer differ.